Well, hi everybody, it's Elaine here from Cerebra, and just having another one of my tea break talks. And today I'm joined by my colleague Derek Tilley, who works on our legal rights project. And it's lovely to see Derek because I haven't seen him in person now for over a year.
Oh, yeah.
Is that right, Derek?
Yeah, it's got to be probably beginning of February or something. It was last time I was in command.
Yeah, in a different lifetime, wasn't it? So,
yeah.
So it's great to catch up with you today, because I know lots of families struggle with the sorts of things that we're going to be talking about today, sort of just to explain how our services and information can help them. So just over to you, really, just to say a little bit about the Legal Rights Project and how it can help, what it can do.
Okay. The project, which is the full title, is Legal Entitlement and Problem Solving Project. There's a number of components to it. How best to describe it? We have a small team based in Carmarthen. So besides myself, there's Beverly, who heads up the Carmarthen side of things, my colleague Caris, and we've recently been joined by John, who lives based in North Yorkshire. I think one of the important things is that both myself and John are carers, so we have experience of what it's like to be a carer of disabled children. Also equally important is the fact that Caris is a trained solicitor, which helps a lot, and also she spent a long time working for a local authority, so that brings that perspective to the project. And Beverly herself is a trained solicitor and has experience of working in special needs background as well, so all that is very useful. The second component to the project is based in Leeds, and there is Professor Luke Clements is Cerebra Chair of Social Justice. So Cerebra funds his post, and working with another colleague, Anna, who is also a parent of a child with, in that case, autism. They run a project with students every year in Leeds University. So what we try and do is we take referrals from parents, largely on social care issues, school transport issues, some health issues. We don't tend to do special educational needs issues because there is a lot of support out there, and we try not to duplicate because we are a small team. So we try and concentrate on those areas where it's more difficult for parents to get support. There is a big demand for the service, as there is for all services that give any form of advice or counselling or anything like that. You know, the issues that parents of disabled children have varied and multiple. It's, you know, you don't tend to have just one problem. You will have an education problem, a housing problem, and so forth. And it's well known that carers have higher rates of health issues and depression, and generally lower subjective, if they're asked to score their subjective well-being, they almost universally score lower than any other category of people that are researched. So it's difficult, and obviously over the last 10 years with austerity, local authorities are struggling with their finances, and services have just, you know, slowly but surely disappeared. So we do some casework. We try to take those cases where we feel that we can learn something from and share with parents generally. So we're looking for the commonly recurring problems. Okay. So we do have, as I say, we do take casework. There's a referral form on the website, and we do ask parents to fill that in before we work actively on a case. We also produce a number of resources in the form of brochures, guidance, if you like, on subjects such as social care in England and in Wales. And it's important to realise that we work through England and Wales. The legislation in social care and education is completely different in the two jurisdictions now. There's little or no crossover. So they're two very separate systems. So everything we produce, if we produce social care, we have to do one for England and one for Wales.
Wales, yeah.
Yeah. So we produce documents like that. So school transport, England, Wales, special educational needs or additional learning needs, as it's now known in Wales, or will be from September of this year. We also produce a number of template letters for commonly occurring issues, and there are a lot on the website, so it's well worth parents checking that out. They're arranged by country, so if you're from Wales, just click on Wales and you get them England, get everything for England.
These letters then are for parents to use so that they can write to their local authority or whoever it may be to access the services that they are entitled to.
Yeah, we deal across all public bodies, so we're talking about some school issues, local authority issues, and that could be education, especially some aspects of education, school transport, disability facility grants. That's where people can apply for a grant to have an adaptation to the house or the garden, so that they can access and use the house and the garden as would a non-disabled person. And health as well. It's some issues, some aspects of health. So it's a wide brief, if you like. It's a very wide.
Yes. Yeah, and as you say, these sorts of problems don't tend to happen in isolation, do they? If it's a problem for one family, then it's likely to be an issue for a lot of others. Is that right?
Yeah. This is it. That's a tendency. A local authority will have a particular policy which may be faulty, and that's applied obviously across the board. And so we're getting more into the realm of trying to help influence changes in policy, both locally and nationally. Especially on the national side, that really comes out to the work that we do with Luke, because every year, as I say, he picks a project, and the students volunteer to work on that project, and it ends up with the production of a report. And we've done projects on, for example, school transport. That ended up with colleagues working with Department for Education on new guidance, which still hasn't been produced thanks to COVID.
Well, COVID, yeah.
Yeah, disabled facility grants. Did a project on, and that has been quite impactful. Last year we did a project on what we called Autism Plus. We were finding that parents were asking for social care assessments for their children, and we've been told it's not enough to have autism, you've got to have something else, for example. And it's not restricted just to children with autism, by the way. It's across the board. It's not just good enough to have a physical disability, you've got to have an intellectual disability as well, and so forth. So that was produced a very useful report that was reported on the BBC, for example, and so forth. And that's led to a project this year where the students have been looking at the protocols that the local authorities use for carrying out assessments. So that's going to be a really interesting read when it comes out in a couple of months.
Yes. And as you say, the hope then is, that's going to influence policy changes, isn't it? So it will benefit everybody.
Well, yeah, the first thing is to get the policy changed. Unfortunately, as we are learning, policy change doesn't necessarily reflect in changing practice, and that's what we need. That's what we really need. We need the practitioners to be able to tailor the services more to what parents need.
One of our more popular guides is the toolkit.
Yeah.
You do a lot of work around the toolkit, don't you? So you tell people what the toolkit is and how it can help them.
Yeah, this is something that came out of work that that Luke did when he was actually in Cardiff University before he moved to Leeds. He developed the toolkit, and importantly, it was developed with a team of parent carers. So they had a lot of input into it. And the idea is the toolkit. It's basically it's called accessing public services. It's basically how to complain effectively. Luke has categorized the issues that parents have with public bodies into 9 different types of dispute, if you like, and invariably a parent, if it has a dispute with a public service, it will fit into at least one of those categories, and sometimes 2, sometimes 3, and if you're lucky, 4 or 5. And so it's a workshop that we give, and we've given quite a lot now. I can't remember who we've done, but it's probably something like 80 or 90 over the last 2-3 years. Normally it was until COVID struck face to face, and so we would a carers group or a parents organisation would organise a session, and we would go along and present the group to parents face to face, and they're very, I think, very useful. And one of the good things about the toolkit, apart from giving parents some of the tools that they need, it brings parents together. And sometimes, sometimes parents don't have a lot of contact with other parents. And we always say that the most important resource that parents have is other parents. I know that personally, and it's absolutely crucial that parents do look towards each other for support, and both emotional support and supporting. Just simple things like you can get a cinema card if professionals don't tell you this kind of stuff. They don't say that that so and so theatre you can get half price entrance, but other parents will know this kind of stuff. Yes, that's my daughter. She's going to come and say hello.
Going to come and say hello. Hiya.
Hello, Laura. Oh, no, it's okay. You go. Just go. Okay. We'll speak to you later.
See you soon. Bye.
Sorry, I forgot you can't hear, can you? Because I've got the headset. Yes. Yes, I've completely lost my thread there.
Oh, I was saying that the support other parents can give each other.
Oh, yeah.
Important to get together, really.
Yeah, it's crucial. It's crucial.
As
and
you said,
of course,
go on.
Sorry, because that all come to a halt with coronavirus. But we have just started to move online, and we've given a couple over Zoom, which have been pretty successful, actually.
Good.
Yeah.
It's becoming the new way at the minute, isn't it, to do things?
It is.
Online.
It is.
I know, as we were chatting beforehand, we were saying that it doesn't replace that being with people in that environment, sort of face to face. But a positive of it is that perhaps people can join when they wouldn't normally have been able to attend a physical workshop, isn't it? For whatever reason.
Yeah, I just think once the schools go back, because of course parents have got huge issues joining in at the moment because they're homeschooling and that kind of stuff, and they've got the kids in the house, kids on the computer, so they can't access the computer. So
of course.
I think once that's settled down, then it'll be we'll be able to access a lot more parents.
Yeah, and going back to something you said earlier, sort of right at the start, really, about how difficult it is for carers, that feeling of isolation, perhaps lone road, and difficulty in, I can only imagine that in a way life can be hard enough, and sort of the challenge of having to take on a local authority or having to to fight for the service that you know your child's entitled to. It can seem really, really daunting, I would imagine. So we just want people, as many people as possible, to know what resources that we've got that can help them, and that it's there for them. Are there many, because I know as a parent yourself, are there any sort of words of advice you would give others in the same position about how to, if they've got an issue with a local authority or whoever, what should be their first, port of call? What would be the first thing that they should do?
The first thing,
or generally what they should do. Yeah.
I think the key thing is to be organised about things, and not to, if possible, not do it on your own. If you haven't got immediate support from the family, use to get support from friends or other parents. One crucial thing is that in dealings with the local authority or the public body is to get everything in writing. If they say something, send them an email, say, I understand that you said this and that I will get the report in 2 weeks' time, unless I hear otherwise. So if they say, no, we don't do this, ask them to put that in writing, why they don't do that. But it's very important to get as much in writing as possible. And if there are meetings, if you're invited to meetings, often parents say, "Oh, don't really want to go." But it's important to be seen to engage with the authorities, but take somebody along for support, because it's and say that you're going to take notes. They may sometimes authorities don't like it, but at the end of the day, it's important to have this stuff. And if you do need to complain, then it's very, very important to get the organisation's complaint policy and follow it to the letter. Because if ultimately you need to go to another body like the Ombudsman for adjudication, if the complaint procedure hasn't been followed properly, it will you'll just be told to go back and do it again, and you waste a lot of time. And crucially, one of the very most important things is, as we say in the toolkit, is delay. Do not let delay happen. If something is going to be done in 2 months' time, for sake of argument, make a note of that. If you haven't got that report, if they haven't got back to you, chase it up. It's very important, because it happens so easily. And somebody leaves, social worker leaves, or the Senko leaves, and everything drifts, and you're a year down the line and you suddenly realise that nothing's happened.
Yeah. Well, thank you for that this morning, Derek. No and just to reiterate, really, isn't it, that there is a lot of information on our website. So all of the guides that you mentioned for England and for Wales are there, free to download. And also all of the template letters are there. And if anybody wants to access the LEAP project, the details are there, and the form, isn't it? The form is there, to get in touch. So there's lots of things there that can help. To please do just get in touch. I think that's fair to say. Yeah. Well, I really enjoyed the star performance this morning. Thank you for taking the time to chat with me, and hopefully I will see you soon.
Yes, hopefully, with a cup of tea.
Oh, now see, you've got your tea and I haven't got my tea. Epic fail this morning. Take care, Derek.
Okay, you take care too.
Bye.
Bye.